Hello dear viewers, hope all of you will fine. Today I will teach you about the clinical pharmacology of ophthalmic disorders. So let's talk about the clinical pharmacology. So this is the course objective which I have mentioned, which I have already mentioned here. That is, by the completion of the section, the learner will be able to review the ocular structure that influences the drug therapy, discuss the different categories of the drugs used in ENT disorder, review the proper methods of instilling the EENT drops, utilize the nursing process while taking care of clients using drugs related to ENT disorders, calculate drug dosage accurately. Okay, now let's see the general pharmacological principles, pharmacodynamics. So pharmacodynamics, it is the biological activity and clinical effect of the drug. If the drug is working at the receptor level, so it can be agonist or antagonist. If the drug is working at the molecular, at the enzyme level, so it can be activator or inhibitor, because enzyme is solely responsible for activations or inhibitions, while if the drug is working at the receptor level, so it can be agonist or antagonist. Second one is pharmacokinetics, which is directly related with the absorption, distribution, metabolism and excretion of drug. So the drug can be delivered to the ocular tissue as well as locally as well as systemically. So locally it can be given to the patient in the form of eye drops, in the form of ointment, in the form of periocular injection and intraocular injection, while systemically it can be recommended for orally as well as intravenously. Look at here how when that stuff get from down up to there up to his sore throat. So this is metabolism and pharmacokinetics. This is eye and topical medication. So what is tear film? Tear film, under the normal circumstances, the volume of the tear fluid is 5 to 7 microliter, with the normal rate of secretion about 1 to 2 microliter per minute. The drop edit cause in increasing in blinking, squeezing, which propels tears toward the sac. Now let's see here. The drug is passes on the iris in the ciliary body to the systemic circulations, while on this look at the second way, the drug is passing on the lacrimal sac and then it is passing through the nasolacrimal system and then into systemic circulations, while this drug will be from the iris and ciliary body to the systemic circulation bypass the liver. Cornea. As we are studying about the pharmacology of cornea. So before studying the clinical pharmacology of the drug used the treatment of ophthalmic disorder, so you must will have a strong command on physiology as well as anatomy. Cornea, it is a lipid water lipid layer. So the lipid content of the epithelium and endothelium is 100 times more than that of stroma, and therefore allow the lipophilic than to hydrophilic substances. Because of the dual nature of the corneal barriers, drugs possessing both the lipid and water solubility penetrate the cornea more readily. However, the lipid solubility is more important than water solubility. As we know that we have already discussed in our previous lecture that about the lipophilicity and hydrophilicity of the drug. So those drugs which are lipid soluble, so it can easily cross the blood-brain barriers compared to water soluble. So the drug must be water soluble and then it can be excreted from the body. Okay, now let's come toward the factors influencing the local drug penetration into the ocular tissue. The first one is drug concentration and solubility. So drug concentration and solubility, the higher is the concentration, so better is the penetrations. For examples, the pilocarpine, that is the drug which is available in 1 to 4% but limited by reflex steering. The second one is viscosity. Addition of methyl cellulose, which acts as a viscosity enhancer agents, which can increase the viscosity of the formulations, and polyvinyl alcohol, so it can increase the drug penetration so by increasing the contact time with the cornea and adding the drug penetrations. So the second one is viscosity, that can directly influencing the local drug penetrations into the ocular tissue. The third one is lipid solubility. So lipid solubility, the higher is the lipid solubility, more will be the penetration. So it means that the drug which is more lipid soluble, so it can be easily penetrated as compared to the water soluble drug. The fourth one is surfactant or surface active agents. So the preservatives used in the ocular preparations alter the cell membrane in the cornea and increase the drug permeability. For example, benzalkonium and thiomersals. The fifth one is pH. As we know that the normal tear pH is 7.4, which is also the normal physiological pH. And if the drug pH is much different, so this will cause reflex tearing. The sixth one is drug tonicity. When an alkali drug is put in relatively alkali medium, so the proportion of the uncharged form will increase the more penetrations. So in this lecture we have discussed about the drugs used in the treatment of ophthalmic disorders, and then we have also talked about the factors that can influencing the local drug penetration into the ocular tissue. So that may be in the form of drug concentration and solubility, viscosity, lipid solubility, and many more, surfactants, pH, and drug tonicity. So inshallah in my next lecture we will talk about the ocular drug delivery system. This was very simple. If you have any question regarding to my lecture, so you can directly contact me through my WhatsApp, through my YouTube channel. So I'm always available for your services, and thank you so much. So these are the objectives and you must will have to cover it. Thank you so much for watching my lecture.